Hello and welcome to Chapter 7, the skeletal system. So, two quick terms that I want to go over are kinesiology and biomechanics, which are often used interchangeably even though they're technically different. So, kinesiology is the study of movement that blends anatomy, physiology, physics, and geometry and relates them to human movement. It's the science of dealing with the interrelationship of anatomy and the physiology of the body with respect to movement, or it can just be called the study of human movement. You're going to be taking a course strictly in kinesiology after you have completed your advanced anatomy course. And the next term that we're going to talk about, biomechanics, you're actually going to study in depth in Chapter 10 in your advanced anatomy course. But just to give you a little heads up now, biomechanics is the application of the mechanical principles in the study of living organisms. This is the science of movement of a living body, including how muscles, bones, tendons, and ligaments work together to produce movement. The study of mechanical principles and actions applied to living bodies. This might involve looking at the static, which means non-moving, or dynamic, moving systems associated with various activities. The application of mechanical principles such as engineering to human movement. Why is this important to you and why is it important right now? Well, we have already introduced SOAP notes and charting, documenting, and beginning to look at what we might consider when making a treatment plan for a client during a massage therapy session. Kinesiology is the study of body movement, which involves anatomy and physiology. Developing a proper treatment plan for your client requires an understanding of kinesiology. Biomechanics is the study of the effects of movement on the body. It involves math and measurement and understanding the effects of mechanical forces applied to the body during massage require an understanding of biomechanics. Biomechanics is understanding the center of gravity, how much force is being applied for something, how much force is needed to move something, the coordination of movement in general. Whereas kinesiology is the ability to move, how the body is working correctly, especially with various pathologies, how your anatomy and physiology are working in your client to be able to move correctly. And biomechanics is how much force and how you need to apply that massage to help them get better movement. Before we jump right into the skeletal system, you should know that you have an endoskeleton. You do not have an exoskeleton. There are two types of skeletal systems. An exoskeleton is a support structure outside of a living body with tissue growing inside of it. Think of an ant or a crab. You have to crack the crab shell to get at the meat. That is an exoskeleton. We have an endoskeleton, which is a supporting structure inside of a living body with our tissue growing around it. Our meat, our muscles, are around our thigh bone. Our skin is around our muscles, rather than our bone being the outside of our body with all of the tissue on the inside. Do you know how many bones we have? We have 206 bones as adults, but during infancy, humans can have up to 300 bones. As you develop and grow, your bones fuse together to become singular bones, which is why you have a reduced number of bones as an adult. Some individuals have more or fewer sesamoid bone, which is a type of bone that develops within a tendon or joint capsule. Think of your kneecap, which is also called the patella. And sometimes some people have an extra rib. Bones are composed of osseous tissue. This is bone tissue. Your bones are constantly changing. Once they're formed, they are still forming. And in fact, your bones didn't start out the way that they're currently shaped now. As we study further into this chapter and you start to see all of the notches and grooves and fissures and protuberances on bones, you'll be amazed to learn that when you're born, your femur is actually a straight, relatively boring bone, but it's the forces of crawling, then walking as an infant and toddler that actually create these extra fissures and protuberances on the bone, because your bones are where your muscles pull them. And as the body puts strain on the bones, they grow stronger to be able to handle that type of force. So all of your bones begin relatively smooth and begin to form more interesting shapes and attachments for your ligaments and tendons and connective tissues because of the stress load on the bones with movement. Another super cool thing about bones is that they have a piezoelectric quality. So piezoelectric substances are like the collagen in bone. They deform slightly and they vibrate when electrical currents pass through them. Also, when they're stretched or twisted or compressed, your bones produce little electrical currents. And the strength and direction of those currents actually change with the direction of the stress load. Bone formation patterns follow lines of stress load directed by these piezoelectric currents. So it's not only the force and pressure of walking and the torsion of your muscles pulling on the bone when walking and the movement of those muscles, but it's also these piezoelectric currents, these electric currents that are running through your bones, also along with the force of muscular movement that causes your bones to shape their formation as you're growing and continue to do so throughout your entire life. What is a bone made out of? So all bones share 4 features that allow them to work together as parts of the skeleton. So all bones have a rigid matrix that gives them their strength and shape to sustain weight and movement. Bones usually articulate with other bones, thereby transferring forces and movement through the skeleton. This is a very important thing to remember as a massage therapist. When we talk about body mechanics for you, the therapist, we're going to talk about joint stacking because we want you to transfer force and movement through your skeleton instead of hurting very small joints as you're putting downward pressure on your clients during massage, especially for those that you may want to put more force on. The third thing that bones have in common is a connective tissue structure called the periosteum. It covers every bone and provides vessels for nutrition, bone cells for growth, and attachments for tendons and ligaments. It's also the only part of your bone, the book does not mention it here, but it's the only part of your bone that actually feels pain. When you feel pain that's in the bone when your bone is broken, it is in the periosteum. The fourth thing all bones have in common is growth of new bone matrix and remodeling of existing bone matrix are responsible for shaping bones. Your bones are constantly growing and changing. Now, when we talk about osseous tissue or bone tissue, there are 2 main types of tissue. You have compact bone and spongy bone. Compact bone, also called dense bone, has a compact arrangement of hard, inorganic matrix. This makes up the portion of the bone that is the main shaft of the long bones and the outer layer of all bones. Compact bone protects spongy bone and provides the firm framework of the bone and the body. Spongy bone or cancellous bone has larger spaces within the bony matrix than the compact bone does, so it's not as dense, which is why it's not called the dense bone. It is cancellous bone, which makes the bones lighter in weight. Cancellous bone is made of an irregular meshing of small bony plates called trabeculae and is found at the ends of the long bones or at the center of all bones, except the shafts of long bones. In some bones, the trabecular spaces are filled with red marrow, which produce blood cells. And when we talk about blood in the circulatory system, you'll find out that that is remade every 120 days, but we will delve into that later. Just a note about spongy or cancellous bone being lighter because of the spaces in the matrix. Just think about birds. Birds have light skeletons to allow them to fly. Their bones are actually hollow. Your smaller bones in your body that are your spongy, cancellous bone are lighter like a bird. You also have bone marrow inside of your bones, and there are two types of that. There is red marrow and yellow marrow. Red marrow manufactures blood cells and is found at the ends of long bones and at the center of other bones of the thorax and the pelvis. So remember from our body regions, the thorax is also like the thoracic region of your vertebrae. It is your chest cavity, and your pelvis is your hips. It's your entire pelvic girdle. From hip bone to hip bone, that entire area is your pelvis. So what is periosteum and endosteum? Except for the ends that form joints, bones are covered with periosteum, which we discussed earlier. On the inside of this membrane are osteoblasts, which are essential to bone formation during periods of growth and in the repair of bones. In addition to blood and lymph vessels, the periosteum has nerve fibers that alert the person to trauma, such as a blow to the shin or fractured arm. What I said earlier is what this means. The periosteum is the portion of your bone that feels pain. So your book is wording it as the periosteum has nerve fibers that alert the person to trauma. That's what pain is. It is your body's response to some type of trauma. It's letting you know, hey, something is going wrong and we're breaking down somewhere. You need to check this out. So when you get kicked in the shin or you break your arm, you feel that pain in your periosteum. Pain, periosteum. A thinner membrane of connective tissue is called the endosteum. It lines the marrow cavity of the bone, and it contains cells that also aid in the growth and repair of bone tissue. So how do your bones grow? The process that creates our skeleton is ossification. When you are an embryo, bone development begins near the end of the second month of pregnancy. So you are already 2/3 of the way through the first trimester of pregnancy before bone growth begins. And this is called ossification. Ossification is the process of building bone by depositing calcium salts into tissues. Calcification is another term to describe the bone-making process, but that can also be a pathology of other tissues. Ossification is a two-part process. You have chondroblasts, or cartilage-forming cells, that create the cartilage model of bones, and you also have osteoblasts, or bone-building cells, that develop the bone tissue from the cartilage model. This process does not create the hard bones with which we are familiar. Instead, these cells remain soft and pliable, allowing the fetus to remain flexible so that it can exit the body more easily during birth. So shortly after birth, hardening of the cartilage into actual bones, which is called osteogenesis, occurs as those calcium salts are deposited into the gel-like matrix of the forming bones. Osteocytes are mature bone cells that maintain the bone throughout our lifetime. So before osteogenesis occurs, you can have up to 300 bones in the body as an infant. And as you are forming and solidifying those bones with osteogenesis, you begin to form your final skeletal form, which usually only contains 206 bones, unless you have a few extra sesamoid bones or extra ribs. You may remember talking about cartilage when we were talking about connective tissue. Cartilage is a tough, flexible connective tissue that has a very high water content, so it is softer than bone. Cartilage forms the skeletal framework in the fetus, and in the adult, after this osteogenesis has occurred, the only remaining cartilage in the bone is called articular or hyaline cartilage. This cartilage is smooth, it's slippery, it's porous, and it's malleable. It has no nerves, no blood vessels, but is found wherever bones come together at synovial or freely movable joints. It allows the bones to move against each other easily without friction. Synovial fluid is secreted by synovial joints and provides lubrication, oxygen, and nutrition to the joint. Articular cartilage is massaged by synovial fluid during joint movement. The degenerative process of arthritis, when people talk about joint pain with arthritis or inflammation with arthritis, that includes the breakdown of articular cartilage. And because cartilage is an integral component of the synovial joint, we're going to discuss it even more deeply in our next chapter next week. Ligaments are a vital, dense bundle of parallel connective tissue fibers that we're going to discuss now. We're going to discuss in the next chapter next week, and you're going to discuss in Advanced Anatomy in Chapter 10, and you're going to talk about in kinesiology, and you're going to talk about in sports massage. Tendons and ligaments are super important for joint stability and for movement of the body. Ligaments, again, are dense bundles of parallel connective tissue fibers, mostly collagen. Ligaments connect bones and stabilize the joints and can also serve as a muscle attachment site. They're not usually elastic. They don't stretch much. Some joint positions place ligaments under tension, where other positions actually make them loose or slacken them. They give them some slack. Imagine stretching a rubber band. That's when they're under tension, and then when you put the ends of the rubber band together and it gets all loose and wiggly, that's giving it lots of slack. So tension in a ligament, usually when you're in extension, makes it tight and tense, and then when you're in flexion a lot of times, it will slacken them. Because ligaments are specific to joint function, they are absolutely discussed in the next chapter and in Chapter 10 in Advanced Anatomy. And like I said, again, in kinesiology and sports massage. So please pay attention to ligaments. An important feature of ligaments is that they are poorly vascularized. So they have very little blood flow, which means they have very little nutrients and very little oxygen intake, and therefore take much longer to heal than muscles do. Since we cover ligaments in depth so many times later, especially next week, we're going to focus right now on bones. And right now, let's move on to the classification of bones. There are 5 major classifications. There are long bones, short bones, flat bones, irregular bones, and sesamoid bones. Long bones are longer in one axis than another. Bones of this type are characterized by a medullary cavity, a hollow diaphysis or shaft. The shaft of a long bone is called the diaphysis of compact bone, and at least two epiphyses or epiphysis, which is the end of a bone. So it has two distinct ends at a minimum, epiphyses, which are active in the growth of long bones. The hollow structure of the diaphysis or the shaft gives strength with light weight. Most of the bones of the arms and legs are long bones, such as your femur, your ulna, your humerus. These are long bones. Short bones, sometimes classified as cubed-shaped bones. These are predominantly cancellous. Remember what cancellous is? Cancellous is spongy bone. Your short bones or cube-shaped bones are predominantly cancellous bones with a thin cortex of compact bone and no cavity. Your example are your wrist bones, your carpals, and ankle bones, which are your tarsals. Flat bones, these are generally more flat than round. Some examples would be your ribs and your skull bones. Irregular bones. These have very complex shapes that occur as two or more forms within the same bone structure. An example would be your vertebrae and your scapula. Your scapula is what we call your shoulder blade. Now, that sort of looks like it would be a flat bone just at first glance, but it is shaped very strange, and it does have a lot of interesting ridges we will talk about at the top of it, and that is why it is in the category of irregular bones. The last major category is sesamoid bones. These are round bones, often embedded in tendons and joint capsules. Sesamoid bones are often considered to be a subdivision of irregular bones. So some anatomy books actually only have 4 classifications of bones because they put sesamoid bones under irregular bones. An example of this would be the patella, which is the name for your kneecap. That hard, movable bone right at the front joint of your knee. That is called your patella. So here's a fun fact about hormones, which we will discuss later in the endocrine system. But bone growth and repair actually relies upon hormones quite a bit. Shortly after birth, we begin the process of changing that pliable cartilage skeleton into more calcified hard bone. Remember osteogenesis? And in long bone, the transformation of that cartilage into bone begins at the center of the shaft. Later, secondary bone-forming centers develop at the epiphyses. Now remember, the epiphysis is the end of a long bone. The long bone continues to grow in length at these centers throughout childhood into the late teens, and you will see this in growth plates very often when we talk about growing pains. It's when children are experiencing pain towards the epiphysis or the end of these long bones as they are continuously spreading and changing shape, causing pain. These are what growing pains are. Now, a growth spurt is often seen during puberty because of the influence of the sex hormones estrogen and testosterone. Both hormones promote the growth of long bones, but testosterone also increases bone density. At higher levels of estrogen, long bone growth stops. This is the reason women generally with higher levels of estrogen are shorter and have bones that are less dense than those of men who have a higher rate of testosterone. By the late teenage years and early 20s, the growth plate or epiphyseal disc of the long bone closes and the bones stop growing in length. The remnant of the growth plate hardens and can be seen on x-rays as a thin line across the end of the bone. Physicians can actually judge the future growth of a bone by the appearance of these lines in x-rays. As we grow, our bones widen and lengthen, and the central cavity also follows this change in size. This all takes place because bone tissue is added in some areas of the bone and reabsorbed in others. As we mentioned before, children are more flexible because their bodies contain more cartilage, and complete calcification has not yet taken place. In older adults, this is reversed. Bone cells outnumber cartilage cells, and bone is more brittle because it contains more minerals and fewer blood vessels. This makes bones prone to fracture and slower to heal. As we age, some of those changes that are going on in the skeleton are things such as loss of calcium and lack of protein. These changes lead to brittle bones. Loss of calcium begins earlier in women than in men. Also, bone fractures heal more slowly in older people. Beginning at approximately age 40, I feel attacked, the vertebrae begin to thin, and the average person loses about an inch of height every 20 years. The cartilage on the rib calcifies, leading to a decrease in the diameter of the rib cage and loss of flexibility. You'll see that this actually becomes an issue with people that have suffered from trauma, or if they are older and they are needing nasal surgery, or they're looking for some other types of plastic surgery where they might need some cartilage. Usually the surgeon will take a portion of the rib, and this can be very difficult in those that are older or have suffered a lot of trauma and they have calcification of the ribs. This can lead to potential injury or extra removed ribs. So you'll see some people coming in that have had plastic surgery or some type of surgery to repair trauma, especially to the face. And they will also need extra considerations for their thorax or their rib area, where some of this rib has been removed, usually in large sections, because of the calcification has required extra removal of tissue. Just as an extra note about massage therapy and changes in the skeletal system due to aging, remember that people over the age of 50 often experience stiffness and aching. Remember, we talked about that breakdown in that cartilage with arthritis. And massage can help manage those sensations, but we cannot reverse them. Adaptive capacity, or the ability to heal and return back to homeostasis, reduces as we age. So we definitely want to do activities that support the skeletal system, like moderate exercise and weight-bearing exercise, but be careful to stay within your scope of practice when talking to clients. And it's very, very important that when you work with clients, especially over the age of 50, remember that age-related changes in the skeletal system are normal. You need to set expectations that are realistic with those clients related to joint range of motion and bone strength when you make care plans for mature or especially geriatric clients. They're not going to be able to bounce back from injury or surgery or any other type of trauma like a younger client would. So your ability to affect change, especially in the joints related to the skeletal system, is much less in your older clientele than what it is for your younger clientele. Not only in terms of healing, but also just in terms of joint pain for chronic issues for things like arthritis. I would like to make a special note here because I understand that we're doing this class online and we don't have a giant plastic skeleton at the front of the classroom. but there is one on campus, and you will be taking a lower body palpation course and an upper body palpation course. You will be practicing on clients in your clinic, and you'll be practicing palpating the bony landmarks on your fellow students in kinesiology and in sports massage and in chair massage, and hopefully on yourself. And I'm going to encourage you to do it with your eyes closed. Cut off as many senses as you can except for your sense of touch. When you find a dent, a hole, a point, a knob, a ridge, anything, identify it as what type of bony landmark it might be, like a meatus, a tuberosity, a protuberance. What are these things? So as we discuss this chapter in this lecture, and as you go through your assignments, I very enthusiastically encourage you, and I believe some of your assignments tell you to do so. Try to feel those bony landmarks on yourself. Try to find someone that will allow you to palpate them that is thinner. Try to find someone with more adipose tissue. If you have your own children, palpate a child, or if you have permission to do so to a niece or a nephew or a friend's child, try to palpate a younger skeleton. Try to palpate your grandparents or someone that is more mature or geriatric if you can. Feel different types of bodies and different types of tissue to see how those bony landmarks feel on different bodies. So what are these depressions and opening and processes that we're talking about that form your bone ridges and indentions and joints? So a canal is a tunnel or tube in a bone. A fissure is a groove or a slit between two bones. A foramen is an opening or a hole in the bone. So a really good example of a foramen is in your vertebral column, in your vertebrae, your spine. There is a vertebral foramen through which the spinal cord passes. So when you look at a vertebrae and you see that big open hole through the middle of all of them, that's so that the spinal cord can run through it. A fossa is a shallow depression in the surface or at the end of a bone. So there is two, actually, the infraspinaeus and the supraspinaeus fossa of the scapula. It almost looks like someone just scooped at it with like a wood carving blade and just made a smooth little indention like a spoon. A shallow depression is like a shallow spoon, not a deep soup spoon, but just like a nice flat teaspoon. A shallow depression in the surface or at the end of a bone. A groove is a depression in the bone that holds a blood vessel, a nerve, or a tendon. A meatus is a tunnel or canal found in a bone. A notch is an indention or large groove. A sinus is an air cavity within a bone. So those are depressions and openings. What are processes or processes that form joints? Well, we have a condyle, which is a rounded projection at the end of a bone that articulates with other bones to form a joint. An example is the medial and lateral condyles of the femur. There is a head, which is a rounded projection on top of the neck of a bone, such as the head of a femur. It looks like a big ball on a skinny little neck. There is a facet, a smooth, flat surface, like the facet of a rib or a vertebrae. There is a process, which is any prominent bony growth that projects, like the olecranon process of the ulna, your funny bone. There is a trochlea, which is a pulley-shaped structure, like the trochlea of the humerus. Now, processes that tendons and ligaments actually attach to have different names. There is a crest, which is a ridge on the bone, like the iliac crest. It is the large, sharp ridge on the hip bones. Epicondyle, which is a projection on a condyle, like the medial epicondyle of the femur. There is a line, and this is a ridge that is smaller than a crest, sort of the way a hill is compared to a mountain. There's the spinous process, spine or spina. This is a sharp, bony, or slender projection, like the spinous process of the vertebral column or the spine of the scapula. There's a trochanter, which is one of two large bony processes that are only found on the femur. There is the greater and the lesser trochanter. There are tubercles. A tubercle is a small rounded process, like the adductor tubercle of the femur. And a tuberosity. A tuberosity is a large rounded protuberance, like the tibial tuberosity. There are so many bones everywhere in the body. There's 206, give or take, as an adult. So we divide them into two major groups. There's the axial skeleton and the appendicular skeleton. The axial skeleton forms the center or axis of the body, which is the head, the vertebral column, the ribs, and the sternum. The axial skeleton provides the body with form and protection, especially of the thorax. The appendicular skeleton is composed of the limbs, which are called appendages of the body, and their attachments. So you have the shoulder and the hip girdles, which have similar structures. Those connect the appendicular skeleton to the axial skeleton. I'm going to go over the bones of the axial and appendicular skeleton in separate lectures so that we can talk about some of the bones and their various landmarks in detail for you. So I'm going to skip ahead in your chapter to pathological conditions. And just so you know, the most common pathological condition of the skeletal system are usually always the result of trauma. There are other pathologies that include developmental conditions, spinal curve abnormalities, bone demineralization disorders, especially in the elderly. Remember, we have a loss of calcium as the bones become more brittle as you age, and disorders caused by necrosis, which is tissue death. There's also infectious diseases, tumors, nutritional deficiencies, and there is also bone cancer. Now, when talking about trauma, severe force can fracture almost any bone. The term fracture means a break or a rupture in a bone. There are avulsion fractures, which is a fragment of bone tearing away from the main mass of the bone. There is a compound or open fracture, where the skin and other soft tissues are torn and the bone protrudes through the skin. A simple or closed fracture, where the break in the bone does not break the skin or injure soft tissue, although the bone itself does break. There is a green stick fracture, where the break in the bone is incomplete. It just produces a split in the bone, sort of what you would see in a green piece of wood where you've bent it and it's split in the middle, but it actually didn't break the limb in half. This is most common in children. Remember, they're still loosey-goosey and flexible. They have more cartilage than adults do. That osteogenesis has not fully gone through its process yet. There are also impacted fractures. This is where the broken ends of the bones are jammed into each other. There is the comminuted fracture. This break involves more than one fracture line. It's several fragments resulting, and often with a ton of soft tissue damage. There is a complete fracture. The break goes across the entire bone. Usually this is a fairly clean break. And there's an incomplete fracture. This break does not go across the entire bone. There's also compression fractures. The bone is squeezed or crushed. This often occurs in the spinal column. There is a depressed fracture where the bone in the skull is driven inward, normally seen by like a blunt force trauma. Stress fractures. This is typically a fracture that is a crack in the bone, often caused by repeated mechanical stress and strain, like an overuse injury. Stress fractures might not be readily detected, and you need to refer your client, if history points towards a mechanical stress condition, such as participation in a really intense athletic event. There's also a spiral fracture, a break in which the bone is twisted apart. This fracture is common in skiing accidents as well as in child abuse, normally by grabbing an arm and yanking it upwards to force a child in standing position. Signs and symptoms of fracture include swelling, pain, loss of function, abnormal movement of the affected part, deformities such as angulation, shortening, or rotation of a particular limb. Crepitation is a grating sound produced when bone fragments rub together, so you might actually hear crepitation. Pain might not occur immediately because of temporary loss of nerve function. They may have also damaged that nerve, so they cannot feel the pain. And it may also be accompanied by shock. We cover bone pathologies pretty well in your pathology class. And right now I mostly want you to focus on learning the bone names and the formations and bony landmarks. But I will go over a few that are pretty common in massage therapy. And that will be shin splints, which involve muscle strain and possibly a hairline fracture of the tibia. This is usually done when you see weekend warriors, people suddenly practicing jogging or running long distances when they're not used to having that type of strain. You have plantar fasciitis, which develops from strain or injury to the plantar fascia of the foot. The signs and symptoms include acute pain when resuming activity after a period of rest. Usually, like when you wake up in the morning, you'll step down on the floor and you'll have incredible pain going anywhere from your foot up to the back of your knee. The pain lessens as the tissue warms and then begins to hurt again with continued use. A deep, sharp, bruised sensation is felt at the arch of the foot and at the attachment of the heel. You're going to work with your clients with a ton of dorsiflexion with this. You are going to do active resistive. You're going to do passive stretching with them. You are going to really focus on this dorsiflexion. And remember from our last chapter, that is the movement of the foot with the toes pointing towards the head. Massage is absolutely beneficial for plantar fasciitis and shin splints as long as it does not cause an increase in pain and inflammation. Tibial fractures are contraindicated completely and need to be ruled out before massage is applied. So make sure there's not actual fracture with either of these two pathologies. The other major ones that we absolutely need to discuss right now are abnormal curvatures of the spine. These can be congenital. They might result from paralysis, trauma, weakness, or tension in the spinal muscles, or they could even be a result of asymmetry, a difference in the length of the lower extremities, like one leg is longer than the other. Bad posture habits, especially during periods of accelerated growth, can contribute to the problem. There is a pediatric client that consistently leans to the left as part of his daily posture and has actually developed scoliosis due to this posture. As discussed previously, exaggeration of the thoracic spine is known as hyperkyphosis. Remember from last chapter. Hyper, it's excessive. Kyphosis, that is the curvature of the thoracic spine. Also, your sacrum has a mild kyphosis on it. Hyperkyphosis or a hunchback. There's also excessive lumbar curvature, which is referred to as excessive hyperlordosis. Lateral curvature of the spine is called scoliosis and is most often found in young girls, especially during or just after puberty. When discovered and treated early, there's often really good results. If you have extreme spinal curvature, you can see compression of the internal organs. This is usually treated with a brace, and in extreme cases, rods are inserted into the spine. Another one that I do not see here in your book is something that we refer to as straight neck or military neck. If you work with a chiropractor or in a medical facility, you'll see this often, especially thanks to the use of smartphones and so many small portable devices. People tend to keep their neck downwards in a flexion, and this constant flexion is taking out that natural curvature of the neck and is straightening the neck or removing that natural curvature of the cervical vertebrae. Sorry, I'm having trouble talking today. So these are all indications for therapeutic massage, unless someone has a fragile skeletal structure, regardless of the cause. You need light, super superficial methods such as gentle laying of the hands, like cranial sacral is a phenomenal modality for some of these issues. You need to consult with the client's physician if the conditions indicate extreme caution. All right, you're going to hear back pain from probably 90% of your clients, and most back pain is caused by soft tissue problems and not skeletal changes. However, sometimes back pain is because of bone spurs, protuberances, issues in the vertebrae that are causing compression of the nerves in the low back. I've been a medical massage therapist, and I have over 20 certifications that relate to osteofunctional or myofascial work. I will not work on my husband's low back at this moment because he has extreme nerve compression, and I do not want to cause any additional damage until after he recovers from back surgery that he will need to have to release pressure on those nerves. So always, no matter how confident you are in your skills, you can cause damage. If someone is coming in due to nerve compression or some type of bone fracture, make sure that you have a note from that client's physician clearing them for certain massage modalities.